Source: Pennsylvania State Summary. According to recent studies, infants and young children in low-income rural areas have a higher risk of third-hand smoking, second-hand smoke than previously reported. Our findings, backed by future research, can help educate parents and caregivers and improve prevention programs to reduce the impact of smoking on children, said Clancy Blair, professor of cognitive psychology at Steinhardt University School of Culture, Education and Human Development and lead author of this study. Children in low-income rural areas who are most at risk of second-hand smoking or smoking in higher education, Science Daily. According to a new Pennsylvania study, infants and young children in low-income rural areas may be at greater risk than second and third-hand smokers. Children in low-income rural areas who are at increased risk of second-hand or third-hand smoke. Other project researchers include Michael Willoughby, a public health researcher at RTI International, Siri Barkentine, head of Education and Human Resources at RTI International, Thomas O'Connor, professor of psychiatry at the Rochester University Medical Center, and Douglas Granger, director and professor of the Institute for Interdisciplinary Saliva Biology Research at the University of California, Irvine. About 63 of the children surveyed had detectable amounts of cutamine, indicating a high prevalence of tobacco use. One of the reasons we have found a high level of exposure is because we tested many young children as young as 6 months old, explains Statskaka, who is also a co-funded professor at the Institute for Social Research. This is one of the first studies to study the risk of secondhand smoke among the youngest children, especially infants, said Lisa Nasir. These figures are higher than the previous National Health and Nutrition Survey, according to which only a third to a half of children's blood samples contained detectable cotinine. Scale and chronic development of smoking in early childhood and early childhood development in the low-income group. 15% of children are in the high-risk population, with a cutamine level comparable to that of an active adult smoker. 48% in the medium-risk population and 37% in the low-risk population. They found that low incomes, low levels of education, frequent relocations and fluctuations in the adult population in the household are associated with high exposure to tobacco, and time spent in childcare facilities is associated with lower exposure to tobacco use. The presence of cutamine indicates that a child has been exposed to second-hand or third-hand smoke. Up to 15 of the interviewed children had a level of kitin, a byproduct of nicotine decay similar to that of adult smokers.